Hello, my dear friends. I welcome you all to the Daily Dose. I am myself Dr. Rajesh Gubba. I am a cardiologist and I am also the mentor for teaching general medicine for exams like NEET PG, AIMS, PGI, and as well as JIPMA. So, as the part of today's Daily Dose, let me discuss this important clinical question. So, I have a 61-year-old man presenting with 2-hour history of moderately severe retrosternal chest pain, which does not radiate and is not affected by respiration or posture. He complains of general malaise and nausea but has not vomited. ECG shows ST segment depression and T wave inversion in the inferior leads. The troponin levels are not elevated and he has already been given oxygen, aspirin and intravenous glyceryl trinitrate. And he is an occasional user of sublingual nitrate and takes regular bisoprolol for stable angina. What would be the most appropriate next step in this management? The options are the intravenous low molecular weight heparin, thrombolysis with alteplase, IV nicardipine, angiography with stenting, and oral clopidogrel. See, first of all, in this particular question, you should be able to come to a diagnosis first. Then only you will be able to decide what management has to be given in the individual. So, the individual is having 2 hours of chest pain, right? That to an elderly male. So, elderly male, that is one of the risk factor for your ischemic heart disease, right? Next. But doesn't give any particular other comorbidities like diabetes or hypertension history is not given in this question. And the other important findings is that ECG is showing ST segment depression and as well as T wave inversions. So ST segment depression and T wave inversions is very much suggestive of the underlying ischemic heart disease. And if you take the troponins they are not elevated, right? So that means your ST elevation MI and non-ST elevation MI is ruled out because troponins are not elevated. And he is already on oxygen, aspirin, nitrates and occasionally taking glyceryl trinitrate and it also takes beta blocker, that is bisoprolol. So what would be the next line management in this particular patient? Now he comes under the category called ACS, that is acute coronary syndrome. So acute coronary syndrome has 3 entities. Number 1, unstable angina, non-ST elevation MI and as well as ST elevation MI. So these are the 3 entities under the acute coronary syndrome. You take in case of non-ST elevation MI and as well as ST elevation MI, the troponins they are elevated, right? The troponin will be positive and the troponins are elevated. Now, but what the question gives, the question is the troponin levels are not elevated. So that means this individual comes under your unstable angina. So in stable angina and as well as unstable angina, the troponins are not elevated or the troponin will be negative. But why do you consider it as an unstable angina but not stable angina? See, the point is he is complaining of the generalized malaise, nausea, but no vomiting and moderately severe retrosternal chest pain, and that is not radiating. So the question is not mentioning about whether the individual is on exertion he is having chest pain or at rest he is having chest pain. That is not mentioned. So if it is not mentioned like on exertion the chest pain is not there, that means we need to take into consideration at rest the individual is having chest pain, because on exertion it is not being mentioned. Now, what is the difference between unstable angina and stable angina? In stable angina, the individual will have chest pain which increases on exertion and it is relieved by taking rest. Whereas in unstable angina, the individual will have chest pain at rest and it has to be relieved by your anticoagulants. It has to be relieved by anticoagulants. Whereas you take patients with stable angina, the chest pain will get relieved by taking sublingual nitrates. And the question also says that he is on occasional sublingual nitrates, but still he is having chest pain. That means it is not stable angina. So these 2 points are very, very important. Stable angina, the pain relieves by taking rest and as well as by taking sublingual nitrate. If it is not relieving by taking sublingual nitrate, think of unstable angina. Now, in case of unstable angina, the important management is the anticoagulation is very important management. So what is the answer here now? That is the intravenous low molecular weight heparin is the one that you need to give, because already the patient is on a single antiplatelet, that is aspirin. So requirement of clopidogrel is not very important in this particular patient. Then what about other options? You take thrombolysis with alteplase. So before that, I'll just show you what all can be the ECG findings in patients with the unstable angina. Unstable angina patients, they can have normal ECG also. Then how to diagnose? You need to do a serial ECG monitoring if you are suspecting unstable angina based on the clinical findings or based on the clinical history. And these patients with the unstable angina, they can have just only T-wave inversions, or they can have just only ST segment depression. So these are the points that you need to take into consideration about the ECG of the unstable angina. Whereas you take the management with the thrombolytic agents. So if you see this thrombolysis, it is indicated only in patients with ST elevation MI, because in ST elevation MI, it is the transmural infarction. Right, it is about the, like the individual with MI, they have the transmural infarction. Okay, so only in that clinical scenario you require to give thrombolysis, either with alteplase, retiplase, tenecteplase, streptokinase, urokinase. So these are the thrombolytic agents what you need to consider. Whereas you take in patients with non-ST elevation MI, here also you should not give the thrombolysis. There is no indication for thrombolysis even in patients with the non-ST elevation MI also. Whereas you take in patients with unstable angina also, no thrombolysis. Then what you need to give in patients with unstable angina or non-ST elevation MI? In patients with unstable angina and as well as non-ST elevation MI, you need to start the patients on anticoagulants. Right? You need to start the patient on anticoagulants. Then what about your, so this is the ECG of your ST elevation MI. So you can see that this is your ST elevation MI, which is there in the anterolateral leads. So this is the ECG suggestive of anterolateral MI. Right, this is the ECG suggestive of anterolateral MI. So where all you have ST elevation, you have ST elevation in lead 1, AVL, and as well as V1 to V6 almost. Right, so this is your anterolateral MI that you need to consider, wherein you need to give thrombolysis in this patient. And you take about this angioplasty. See, angioplasty can also be considered even in patients with unstable angina or even in patients with non-ST elevation MI. But first of all, these patients should be given the anticoagulation, and this particular anticoagulation you can give unfractionated heparin or low molecular weight heparin, or you can also give the fondaparinux. And once the individual is stabilized, then you should do an angiogram. Right, and if the angiogram shows the blockade more than 70%, right, if the angiogram shows blockade more than 70%, then you need to put the stent to the patient, wherein you will do angioplasty. Right, wherein you will do angioplasty. So angioplasty is indicated only when there is a coronary artery blockade of more than 70%. So going back to the question now. So alteplase not given in this patient. Nicardipine is a calcium channel blocker, not given in this patient. Angioplasty with stenting after stabilizing the patient with the anticoagulation, and that too if the coronary artery blockade is more than 70%. And clopidogrel is not a very emergency thing that you need to give in this patient. So the question asked is most appropriate next step in this management. So what is the most appropriate next step in this management? You need to give anticoagulation either with unfractionated heparin or low molecular weight heparin or fondaparinux. So this particular question is completely on the management of unstable angina. So I hope like you might have liked this particular short video. So please follow us on the daily dose for the daily updates. Thank you very much.